Just take a few minutes just to give a formal introduction about you. So, even though you are very familiar and very well-known personality in the field of pharmacy profession, so it's a wonderful webinar. And now I would like to introduce our resource person and renowned speaker. He has started his career as a lecturer at SCS College of Pharmacy in 1979, and till 1984 he was working there. And his profession as a lecturer again in pharmacy group, BITS Pilani. This is between the duration of 1984. It was in the duration between 1989 to 1992. And then he continued his profession as a professor in BA College in Harpanhalli between the years 1993 to 1995. And further, he continued as a professor and principal for December. And he was director for SCS College of Pharmacy, Harpanhalli, between 2016 to 2018. And further, he worked as a director for Amity Institute of Pharmacy between 2018 to January 2022. And at present, he is working as a visiting professor for the School of Pharmacy and Sciences, Bahara University, Himachal Pradesh. And he started working here from 2022, and he is working here at present. And in addition to that, Sir has got very good industrial experience also. So he worked as a research coordinator for regional research laboratory, that is Jammu Tawi, that was between 88 to 89. And he was worked as a quality control inspector, that is Sanapa Labs, Bangalore. And he was a trainee at Bharat Greece, India, that is Bombay. And he has undertaken several projects, and he has guided several researchers, and he has guided 6 PhDs and 3 undercourses, and he has guided almost around 110 master's students and around 80 undergraduate students. And Sir has got very good community service experiences, and he has established so many firms and so many associations, and he is a founder member, etc. And I think I have to take a long time. Sir, I take a kind excuse. Short. Yeah. Sir, I can pass up to you, sir. I'm taking your time.
Thank you very much, Uganda. Claire, can you share my slides in the meantime? So we are, in fact, we do have a community pharmacy, but it is unrecognized and unofficially existing. Why I say so? Because see, all the drugstores present in the country, from Kashmir to Kanyakumari and Kolkata to Ahmedabad, the mentality of the drug shop owners is not only profiting. If that were the thing, then they would have been in a different scenario. I would like to give an example of my father, who was a community pharmacist, and I draw a lot of inspiration from him. See the instances, for instance, I will tell you. He was a very good person. So he was in Karnataka when there was no college and no qualifications were available for the pharmacist. So just English knowledge, and then one crash course of 3 weeks or 1 month in Bangalore. So that would have been given them the shop owner. And just a minute, some small disturbances there. I'll join you.
Yes, sir. Go, please.
ಏನ್ ಬೇಕು ನಿಮಗೆ ಅಷ್ಟೇ ಸರ್ 1 minute, sir. 1 minute. Okay.
It's okay, sir. It's okay.
So in those days, there was one snake bite antivenom was available from the Hopkins Institute, which was costing around 500 rupees. So 500 rupees in those times were a very big amount, and father used to keep that stock always because he wanted to save the people's lives. So as a result of it, in and around the village, other chemist shops were guiding the patients to my father's shop. And I still remember when I was young, the night times, the villagers used to come and use that ask for the injection. So several times it used to expire. My father never minded it. So this is how he was earned a very good name in the community. And what happened afterwards? He became very rich due to his luck, and he diversified his business. And again, after some time, what happened? All his business went into loss, and he became pauper. At that time, he came to medical shop again. At that time, what happened? There was a community awakening. People wanted to see that he is he runs a medical shop because they wanted the Nagappa to be in the business. The Nagappa is my father's name. Actually, my guide in BITS Pilani gave me this name, Nagappa, as my certificate was telling Ananta Naik Nagappa. So he put my name as Nagappa. So anyway, I'm taking the blessings of my father, and that's why it's going on. So now, community came and to his help, and he was he could revive his business, and he got all the misery gone. So what I want to say is, community is awakening. So you must not think that community will not be having responsibility. They will be always observing the people, what we do and how we have to do all these things. So in that time, what will happen? The community came to his rescue. So what I mean to say, the community, you don't consider that community is mute and it doesn't react and all those things. So community is a very active thing, and people are observing what is happening in this thing, and the medical shops are all know about this. But again, due to change in the scenario, due to change in the conditions, people are getting misguided. And what's happening right now? The online business has become the order of the day, and people are going for discounts, and they are not supporting the education, the business. So these people are getting a lot of trouble, and it is said that the community pharmacy will not sustain in India. All drug stores will be closed, and we have to see the end of the community pharmacy. Then, is it true? Will it happen so? Because I have traveled several countries with the name to see that the community pharmacy will how the community pharmacy works. I've seen people helping the patients and they enjoy a lot of respect. You also know it. Why the respect comes to them? Why not to in India? Our own classmates, benchmates, and students gone abroad and earned a very good name in the society. There they have earned a lot of things. Respect is there. So once in Canada, I went there to visit. I have come across a student who is having community pharmacy, independent community pharmacy. And then there, when I visited his pharmacy, I saw a lot of patients waiting for him for his time. So I was wondering why they are coming for the purchase of the drugs. Why they are waiting for you to speak? No, he explained me that community pharmacy, we have to explain to the people about the drug, disease and lifestyle. They are prescribed with it. And then we have to ensure the patient safety. Ensuring the patient safety is our own responsibility. So we have to do it. So there is no other go, and we are doing that. So like that, he explained me, and then I got an idea that in our country, why it is not so? Why our patients are not been benefited by these type of things? See, you people have got a lot of knowledge. I will tell you boldly. You know pharmacology, you know pharmaceutics, you know so many biosciences, human anatomy and physiology. Why it is not being used? Yeah. See, these are the responses. Previous lesson. Previous. These are the important work. The other in developed countries, people are looking in the prescriptions. Overutilization and underutilization is a common problem, and therapeutic duplication. So many brand names in India, so many things are there. So for therapeutic duplication, I came across a case I would like to mention here. So there was an elderly couple, 70-year wife and a 75-year husband. They were all children are working in abroad, so there was nobody to look after them, and the madam became very weak. So we went in a home visit. So we talked to her, what is the problem? She said that I am very weak, I can't do anything and all. My husband also has become old, so we are having a lot of difficulty. Then I said, are you consulting anybody? Are you taking any medicine? Yes. They showed there was 4 medicines they are taking. She was taking. One was the B complex, other was the B complex injection, intramuscular injection, and then the another one is also a multivitamin tablet. I was wondering, what is these doctors are doing? What is they? Who has guided them? And see, when you are proteins are required, you know. Proteins are the source of energy, and the protein is not there. He is taking only B complex in one form, the other form. I was wondering, and I told her, Madam, you do like this. You take moon, hara moon, you know, hara moon. Hara moon. You take one fistful, soak it in water. In the morning you eat. You eat for 10 days. Then after 10 days we will come and see you. So after 10 days we have gone, and she was becoming more energetic, and she herself got well, and then made tea for us. See, this is the way the duplication, and without seeing what the patient is undergoing. So they are very rich, but again they don't have proper advice. Doctor has no time, and pharmacist also has no time. So in this process, the patient is suffering. So like this is a very simple example I quoted, and then I continued to work on this way, and then I came across many college-going girls used to come there to the thing. She will not discriminate, and she will take care of that. So we have to take inspiration from that, and then we have to develop our profession. So whenever we are having opportunity, our knowledge should be made to use, put into use. So, dear friends, now with all these things, I would like to say care. So after that, So it was started in the Pune for 1 year trial, and then she had other opportunities, so she had to protocol. This is the WHO and FIP. And can I have the next slide, please? So there is a case study. I want someone of you to read the case study for me. Next. So please read this case study, and I will explain in between.
Yeah. Mr. W, a 53-year-old woman, has undergone. Sorry. Yeah. Mrs. W, a 53-year-old woman, has had gastrointestinal acid-related disorders diagnosed by endoscopy, and Mrs. W has a history of asthma, hypertension, and duodenal ulcer. Today, amlodipine, that is.
And this is due to this. He is a student, he can enzyme called as urease, and that is be able to break the urea into ammonia and water. Ammonia and carbon dioxide, isn't it? So when this test shows negative, when this test, because human beings don't have urease enzyme. When the patient gets rid of this, there may be the asthma can be reviewed very simply by using a free flow meter, asthmatic drugs. You can immediately call the doctors and ask him to review the asthma. In his clinic, he will review and finds out that the patient is not having patient more healthy, and quality of life is also very much improved. Can I have the next slide, please? So home any medicines they are having any problems out of the medicines, then we used to resolve. They never ask it very difficult questions, and ask it very simple questions. And these answers we had. Suppose also we don't have answers, we used to go home and have the next slide, please. Can I have the next slide, please? There are some photographs are there I want to show and end my talk. So this is the way we must work out. Nurses, physicians, and pharmacists and other care healthcare. Patient-centric care is more important, which is not the market-centric care or product-centric care. To this thing by all your efforts, and this thing. Yeah, next. There are some photographs are there I want to show you. Come down, sir. Come down. Yeah. Come down. Come down. So see, this is a photo of my student who are giving the home-based care. We used to visit their home, and we used to see that what is happening to them and make a record of it. And not every day we used to go. We used to go once in a week, and then we used to build up the database and then help the patient issues with drugs, disease, and lifestyles. Next slide, please. So this is again a patient who is bedridden. So for her also the BP was a problem, and she was not knowing that pickles she should not eat. We advised her to control pickles, and then after 4 or 5 days, her BP came under control because she stopped eating pickles less. Okay. So this is again a patient with another serious condition. She was also helped by us. So next slide, please. So student making entry of the data, the patient's home only. So this is also another photo where we are giving the pharmaceutical care. So after all this, what happened? The people started recognizing us. Somebody identified me as a moong. So everyone, I used to tell them that you eat moong, 15 days to see what is the responses you find it. So like that, I was recognized as a moong doctor, and we used to get invitations for the family functions, for their children's birthdays. Weekly once we used to go, and with our knowledge we could resolve their issues. So that was the importance of us. Yeah, next slide, please. So for the government, it is cost saving, include wastage of unused medicines, improved preparations. Yeah, same thing. Classified, same thing. So, next slide, please. I think I'm end of the presentation. Please, this is the Community Connect program. I want to tell you, with this idea, your college, I request all of you to take initiative to help people in their own problems and issues by visiting them, and take a medical shop as a point of contact. And then when you are free in the evening, you can go there and you can meet the people and help them in their conditions. So I end my talk here. Any questions are there? You please think. What I suggest you is, you please make a WhatsApp group of Santhiram College of Pharmacy Community Connect. So there, through that we will meet the public, and you get in touch with a medical shop owner, and then you can go and do your service. And as long as you continue to make a beginning, then you will have a very good report. Next year, your college will be having well known for its this thing, because students learn the skill of talking to uh, the patients. Communication problems will be resolved, their skills will be developed, so clinical skills will be developed. So this one we must always do it. At a national level, we are going to develop this. Please join your hands with the Association of Community Pharmacists of India. So we are not charging any money for any of these activities. We are only guiding you, so that our intention is the community pharmacy services become very common feature wherever that's why we call it as pharmaceutical care everywhere. So, sir, any questions are there? You can ask the audiences.
Sir, there is a question in the chat box.
Yeah, I'll look at it.
Just a minute.
Load with the patient. If a doctor wants, he can give me classical information. And for a person, for a patient or a health consumer, what information he needs, you have to ask him, have a dialogue with him, and then you have to give. Okay? I think I have answered this question. So for this only, when you have a dialogue with the patients, then you will know his dietary habits, how he is using drugs. So it is an individual case. You have to interact with the patient. That's what I am telling you. Unless you interact with the patient, you don't know anything about the patient. And how you can help him without knowing him? You cannot generalize the thing. Each patient is an independent, and a customized care should be given. That's what in the WHO FIP module they have shown, that you have to interact, and you have to see that every week or every 3 months, every 10 days once, and make the patient self-management of his disease or her condition possible.
Any more questions? Please welcome.
Sir, you can remove that share. Sir, we provide the certificates, because ACPI is a registered body, national body. It provides internship of 2 months, 4 months, 6 months to the students. Many students, after going abroad with this certificate, so it helps them in the admissions and also in the career growth. So they also get an idea. So this is an active process, and this internship certificates are given, and we want to start that internship program in your own institution. So please make some coordinator, and let the coordinator will have several coordinators, 3 or 4 coordinators you can have depending on the size of your college and demand of the students. So you can, and the mentors also will be given certificates by the Association of Community Farmers of India. So we want to start it in a big manner. And the people in the Nanjal will recognize your college very much. See, and your college is going to get an identity, because in my times when I joined pharmacy colleges, the people are asking, "Are you doing commerce?" So this is a common question, and I have to explain him what is pharmacy. So because we don't go to the public at all, we don't remain away from the public, we remain away from the patients. So we have no identity. When you start doing this, slowly people will understand the importance of it, and they will also know what we are. Yes, sir.
How did you come to know about Santhiram College of Pharmacy?
Immediately caught hold of this person and caught hold of you, and you were kind enough to give me Dr. Mrityunjay. He took interest, and now he has got 3 teams and with 21 students, and he is within the public, and one more training is there. I will conduct 4 or 5 program, 4 or 5 online programs like this, and then we will through. Dr. Mrityunjay is a PhD in analytical chemistry, but still he is very much interested. So all his faculties and all, they also got up the things quickly, and now we are in the way of one meeting with me again. He will go to the field, and they have a training program of measurement BP.